here. Tens of thousands of first responders and recovery workers, as we know, were on the ground at the World Trade Center back on 9/11. Many of them were there for days, weeks, breathing in that toxic dust and debris. 24 years later, medical experts are still studying the long-term impact to the workers. And joining us is Dr. Anahita Dua, a vascular surgeon and founder of and chair of Healthcare for Action. Doctor, thanks so much for joining us on this anniversary. So help us understand how this kind of exposure can impact not just your lungs, but also your heart and your vascular system, your blood vessels.
Absolutely. I'm glad to be here, but of course, talking about such a sad thing on this anniversary. Of course, we all remember it, so vividly. So initially, essentially, the way that the diseases impact the vascular system are all connected. The vascular system basically is like the pipes of your body, obviously carries blood where it needs to go. The biggest thing that we're starting to see, unfortunately, these days is that there are many patients that are having leukemias and other types of blood type diseases where they're not actually making what we call platelets, which are part of the blood system that actually allow you to form clot. Clot typically is bad, but usually you need clot to form in case you get an injury. And of course, in case you get an area where you want to make sure that your blood can flow properly, but also is not too thin. Otherwise, it can actually come out of the vascular system. And what we're seeing is because of some of the exposure during that time, some of the chemicals that were in the air, and especially in people that were there repeatedly, who went back to ground zero to clean up or who were there helping victims, those patients are now starting to come out with different types of anemias where essentially the platelets and the red blood cells are not being formed in the vascular system. The other aspect of the vascular system specifically is the intense load on the circulatory system that is being formed by things like cancers. As you mentioned, people do have lung disease, for example, COPD, interstitial pulmonary fibrosis, things of that nature. And when that happens, unfortunately, we don't have enough flow going through the system because of the cancers that actually are taking away a lot of the nutrients and a lot of the growth hormones and things that you need to function.
And Dr. Dua, how is it possible for doctors 24 years after the fact to connect it to 9/11? How do you know when you see leukemia that it isn't just, a one that has grown organically? How are there some markers that you can tell that it's connected to 9/11?
Oh, it's a great question. Actually, there is a World Trade Center health program that the government has put into place and has been around for a really long time. And this program basically has people that actually determine whether or not there was a connection. And there are many ways to figure that out. It has to do with the normal way in which people would get leukemias and whether that particular patient would have necessarily gotten it if they had not had this extra exposure. Obviously, we err on the side of caution and ensure that the patient gets the benefit of the doubt. But there are up to 60 diseases now that are covered by this commission. And the reason that that's important, and there's an occupational health component to that as well, is because then the patients get not only the treatment covered, but also the ability to follow along as to, if they get something that occurs maybe 10 years out, the commission can say, yes, this is something that we cover. If you had exposure at 9/11, we already know that this is something that's connected back to that. And as a result, we'll cover you. Very similar to how patients at the VA are covered. If they were exposed, for example, to Agent Orange, there's certain things we know that are connected to that. And of course, if they also happen to be a smoker, we can say, well, your chances of getting lung cancer were this, but because you had Agent Orange and the fact that you're so young and you got this disease, it likely is that the Agent Orange contributed to where you are today. And so that's the way in which we determine it. I will say currently, there's a concern that there might be a pause on new diseases being covered. Most recently, uterine cancer has been covered as a new disease that can be attributable to some of the workers that unfortunately were at 9/11. But there's some new diseases that are being identified. And because there's been a bit of a pause, even though it's not been official, New York State, for example, has been pushing to say, hey, you guys need to be a bit faster and you need to make sure that these things are covered because people are dying, people are sick, and they can't go and get their health care if they're not covered appropriately.
Doctor, you're talking about a range of health issues. What warning signs should first responders or survivors, and really anyone with exposure to any of this type of polluted air, be watching for when it comes to their cardiovascular health?
So the most important thing is, now we're years out, and so people are going to be a little bit older. And like you rightly pointed out, and like was mentioned earlier, people are going to start to attribute some of these factors to just aging. And the number one thing is don't do that. It's not the patient's job to sort out what's wrong. It's the patient's job to just ensure that they come in front of a doctor and say that they were exposed. Because, if somebody just walks up and starts to talk about their disease process, maybe let's say somebody's, in their 60s at this point, and they come and say, hey, I have this bad cough that won't go away, and, I had the flu a month ago. Generally, if without knowing any other history, a doctor might say, oh, it might be just sequelae from that. But if you add to that, hey, by the way, I was also a responder on 9/11. I had multiple exposures to ground zero. Now suddenly it changes the game. Now suddenly, as a doctor, I'm going to say, hey, you know what? Let's not wait for that CT scan. Let's not wait for that X-ray. We need to get it now because this could be cancer. Because there's a phrase in medicine that when you hear hoofbeats, you need to think of horses, not zebras. In other words, rare diseases, odd diseases, they can be, but usually you want to think about common things. So common things being common, if someone has a cough, you want to think about the normal things that it could be. But if you add this element that, hey, I was a responder at ground zero, suddenly one of the common things, sadly, are lung cancers, the mesotheliomas, the fact that asbestos was around, and that caused, unfortunately, skin cancers along with many other issues. And so now a doctor will think, hey, I need to be a little bit quicker about checking out those diseases as well. So that's the advice that I would give to our patients, that just if you feel like something is wrong, don't wait, because especially in some of these bad cancers, we really need to get you taken care of quickly.
Just quickly before we let you go, if somebody is new to this and they realize, oh, now I have a health problem, and they haven't been part of this health program, can they still join and still be part of it?
Oh,
Track
absolutely.
these? Yeah.
Yes.
Okay.
So the way that it works is the health program is all about identification of the diseases. To the point that was made earlier, we couldn't just say after 9/11, hey, here are the 10 things that could happen to you. We didn't know. Some of the stuff has to do with inhalation of the particles. Some of the stuff has to do with exposure to the chemicals. Some of the stuff is mental, PTSD. Some of the survivors even, going through horrible things. And so the important thing is, as the diseases actually come out, us identifying them and then saying anybody who gets this, who was associated with this kind of exposure, we cover it and we care for you. And that's the government, doing their part. But as I mentioned, that program's really important. We can never forget, as we say about the event. And so never forget is ensuring that those who live through that are well taken care of. And that's all the way from they get early health care, they get coverage, they get treatment, and they get our benefit of the doubt that if they're sick today from that, we take care of them and we do the right thing.
Doctor, we
Dr.
thank
Dua,
you so
thank you.
much. So much good information there for people who are dealing with the after effects of being down at ground zero. All right.